Meet Dr. Thiago, a seasoned urologist with over 20 years of experience, and his patient, Mr. Pedro, a 57-year-old man who recently walked into his office with a story that might sound familiar to many men over 50. For months, Pedro had been struggling with a weak urine stream, waking up multiple times at night to use the bathroom, and the frustrating feeling that his bladder never really empties. After a thorough evaluation, Dr. Thiago diagnosed him with benign prostatic hyperplasia, or BPH, a condition millions of men face as they age. The standard treatment was straightforward, a prescription for tamsulosin and but when Pedro read the medication leaflets, he became worried about the possible side effects, from dizziness to loss of libido. So, like many others, he turned to the internet in search of natural solutions. That's when he kept seeing glowing claims about something called Saw Palmetto. Blog posts, YouTube videos, and online forums promised it could shrink the prostate, improve urine flow, and even boost vitality, all without side effects. But how much of this is real, and how much is marketing hype? Before we go any further, I want you to drop the number 50 in the comments if you're over that age, or know someone who is. And don't forget to like and share this video, so more men can get the facts. Stay with me until the very end, because I have a very important message that could change the way you look at prostate health forever. Saw Palmetto is an extract derived from the ripe berries of the Serenoa repens plant, a small palm that grows naturally in the southeastern United States. For centuries, Native American tribes used it for urinary and reproductive health. Today, it's marketed worldwide as a supplement for men's prostate health, particularly for easing symptoms of benign prostatic hyperplasia. Its proposed benefits come from how it interacts with the body's hormonal pathways. Saw Palmetto is thought to act as a mild anti-inflammatory, reducing swelling in the prostate tissue. More importantly, it appears to block certain testosterone receptors and inhibit the enzyme. This enzyme is responsible for converting testosterone into dihydrotestosterone (DHT), a hormone strongly linked to prostate enlargement. If this sounds familiar, it's because some prescription drugs, like finasteride and work in a similar way, lowering DHT levels to reduce prostate growth. The big difference: Saw Palmetto is a plant-based extract, rather than a synthetic pharmaceutical. But here's where things get tricky. Not all Saw Palmetto is created equal. The way it's extracted can significantly affect its potency. Two common methods are alcohol extraction and hexane extraction. In European clinical trials, products made using the hexane method have shown the most consistent results. Unfortunately, many supplements on the market don't specify which method they use, and this could make a huge difference in effectiveness. As we move forward, keep this in mind. Understanding how Saw Palmetto is made is just as important as knowing what it is. Next, let's take a closer look at the scientific evidence and see what the research really says about its results. When it comes to supplements like Saw Palmetto, personal stories can be powerful, but science demands more than anecdotes. Over the years, dozens of studies have investigated whether Saw Palmetto truly helps men with BPH. The results? Mixed. And that's where things get interesting. One of the largest analyses to date was a meta-analysis involving over 5,200 men. Researchers compared Saw Palmetto with a placebo and, to their surprise, found no statistically significant difference in urinary symptoms or flow rate. On paper, that might sound like a strike against Saw Palmetto. But then we look at European trials, particularly those using a specific hexane-based extraction marketed under the brand name Permixin. These studies told a different story. Men taking the hexane-extracted Saw Palmetto experienced an average 35% improvement in nocturia, meaning they woke up far fewer times at night to urinate. They also saw an increase of 2.7 milliliters per second in urinary flow, a meaningful improvement for those struggling with weak stream. Even more compelling, in some head-to-head comparisons, this form of Saw Palmetto performed similarly to prescription drugs, like tamsulosin and finasteride, but with fewer reports of sexual side effects. So why the conflicting results? The answer lies in the details. Not all Saw Palmetto supplements use the same extraction process, dosage, or quality controls. The positive data largely comes from standardized European products, while many of the no-benefit studies involved lower quality or differently extracted versions. This means the science isn't saying it doesn't work, it's saying it works if the right product is used. And that brings us to a crucial question. What are the limitations and risks that you should know before trying it? Let's break that down next. While Saw Palmetto can sound like a natural, side effect-free solution, the reality is more complicated. One of the biggest challenges is consistency. Unlike prescription drugs, which are tightly regulated for dosage and purity, supplements often vary significantly from batch to batch. Even bottles from the same brand can contain different concentrations of the active compounds, which means your results may be unpredictable. A key factor is the method of extraction. As we discussed earlier, the European research showing real benefits used hexane extraction, a process that preserves a specific profile of fatty acids and sterols, believed to be responsible for the therapeutic effect. In many countries, including the United States and Brazil, most products are made using alcohol extraction, which doesn't always yield the same chemical profile, and may explain why studies outside Europe often show weaker or no results. Another limitation is availability of verified high-quality sources. In Brazil, for example, the method of extraction is rarely disclosed on labels, making it nearly impossible for consumers to know if they're getting an effective form. Medical guidelines reflect these uncertainties. The European Association of Urology positions Saw Palmetto as a second-line option, something to consider if standard treatments fail or if a patient cannot tolerate their side effects. In short, Saw Palmetto is not a magic bullet. For some men, especially those who find the right formulation, it may provide relief. But for others, the lack of standardization and quality control could mean wasted money and no improvement at all. Now, knowing all this, you might wonder, if there's potential and fewer side effects, why don't doctors prescribe it more often? The answer to that is next. If Saw Palmetto can work, at least in certain forms, and tends to cause fewer side effects than common prescription drugs, why isn't it more widely recommended by doctors? The short answer: uncertainty and accountability. Medical professionals are bound by ethical and legal standards to offer treatments with strong, consistent, scientific backing. With prescription medications like tamsulosin or dutasteride, doctors can be confident that every pill contains the exact same dose, manufactured under strict regulations. The outcomes are predictable, and the data is extensive. With Saw Palmetto, the opposite is often true. The lack of standardization means that two patients could buy the same supplement brand and get entirely different results or no results at all. For a doctor, that unpredictability makes it harder to rely on as a first-line treatment. Another reason is evidence strength. The most convincing studies are tied to hexane-extracted products, but those specific formulations aren't always available or affordable in many markets, including the US and Brazil, without access to the proven version. Recommending any Saw Palmetto would be like prescribing a medication without knowing the dosage. Finally, there's the principle of first doing no harm, which includes not wasting a patient's time or money. While Saw Palmetto can be an option for those who can't tolerate standard drugs, most doctors prefer to start with treatments that have predictable, measurable results. Still, for the right patient, it can be worth trying. And that's exactly what we'll cover in the conclusion, along with some important final recommendations. So, where does all this leave us? Saw Palmetto is not a miracle cure, but it's also not a useless myth. The truth is somewhere in between. When extracted properly, specifically using the hexane method, and in the right dosage, it can produce results comparable to standard medications, with fewer side effects. The problem is, most products on the market don't meet those standards, and many don't even tell you how they're made. If you're considering trying Saw Palmetto, the smartest move is to talk to your doctor first. Ask about the extraction method, the concentration of active compounds, and whether the product is standardized. If you live in a place where hexane-extracted versions are available, that's the form with the strongest evidence behind it. For men who can't tolerate the side effects of drugs like tamsulosin or dutasteride, high-quality Saw Palmetto can be a reasonable alternative. But go in with realistic expectations, and be ready to switch approaches if you don't see improvement. If you've made it this far, you've already taken a big step toward being informed about your prostate health. Now, here's that important message I promised at the start. Prostate problems don't just affect your bladder. They can impact your overall health, energy, and quality of life. The earlier you act, the better your chances of staying strong and active. So, subscribe to the channel, hit the like button, and share this video with someone who needs to hear it. Your future self will thank you.